Welcome to Autism Tips and Tools, where we highlight the best practical guidance from previous episodes of Autism Knows No Borders. Whether you're a self-advocate, a family member, or a service provider, there's something here for you. I'm Rachel Harmon, a professional in the field of autism services, outreach, and advocacy, and the following clip is from my conversation with the CEO of the Global Autism Project, Molly Ola Pinney. Here's Molly talking about how creating sustainable change begins with listening, from building local capacity of autism services with our international partners to understanding the needs of the autistic community.
It really does speak to how we do our work here. You know, the why we do our work is the partners around the world. The why we do our work is because we know that in places where autism is little understood, it can put people in harm's way, honestly. That's really why we do this work. And the how of it is doing with the local community. See, a lot of times in international development work, it will be somebody coming in and essentially, you know, we've all heard the proverb, right? Like, give a man a fish, he'll eat for a day. Teach a man to fish, he'll eat for a lifetime. And it's a lot of giving fish, right? And just saying, here's a fish for you and a fish for you. I actually like to take that one step further. I like to take that to ask them if they're hungry and what they like to eat. Because I think a lot of times in international development, what we see, what we experience is that people are coming in and not only just handing out the, fish, so to speak, but they're also just handing out fish to people who don't necessarily eat fish. Vegetarians, maybe, literally. So I think the do with, not for really just talks about the importance of that, of asking people, of starting with a conversation. One of the things that has been true about our work for as long as we've been around is that we work in places where we are invited. We don't go, looking at the whole planet and going like, oh yeah, that would be a great place to work. In fact, partners who work with us around the world, they apply to be a part of the Global Autism Project network. It's not a paternalistic, like, let us come and help you. It's like, these are people who are going to work in partnership around the world. What we're really building is a global network of people to do this work. It's really easy to feel alone and therefore desperate if you are the only people doing the work in this community. Mm-hmm. And that's one of the things our partners share with us all the time. I mean, we were just on a call and our partner, Mafer, who I know has been on here as well, was sharing that in Ecuador, right now we're doing this leadership training with all of our partners around the world, Thursday mornings. And today we just had one. So we're always extra excited after. It's just this amazing moment where it's people from all over the world coming together, sharing their experiences, sharing their challenges, sharing their joys, and just being with each other. And it's not translated. It's run in English currently. And so obviously that's a barrier that we are working on. And also what she shared is that, she's like, my team isn't able to understand every single thing that's being said, and they get so much out of it because they don't feel alone and they feel supported. Mm-hmm. She's always telling us we're making a difference in the world. And it's like just that little thing, and having people awaken to their own power and their own possibility. And that's always been what this work is about. It's about this idea that we're stronger together. If we were going in and doing for them, it would look a lot different. There is no Global Autism Project Kenya. There is no Global Autism Project India. There is no Global Autism Project Ecuador, Rwanda, Ghana. Wherever we've worked, there is no Global Autism Project there. We do not establish our presence. We support them in building their capacity to provide services.
Yeah. Can you give an example for someone to understand, like in a practical sense, what would doing for look like and how would that compare to doing with?
Yeah, so there's a few different ways it can look. One of the things could be just coming in and actually doing the work with the kids. We see this sometimes in just going in and performing the surgeries and then leaving, with the idea that, well, it takes a lot of training to do surgery. It takes a lot of training to do this work. And doing with looks like actually providing that training. actually providing that support and working yourselves out of a job. And, I think that that's one really important piece. Doing four might look like we raise all the money and we build the centers around the world. We don't do that. All of the centers are independently owned and operated. They are not Global Autism Project. They are part of the network. They receive training from us. Some of them sometimes have a sign that say Global Autism Project. Many of them have pictures on the wall from our visits, just as we have pictures on our wall from our visits. But yeah, it's really about establishing independence and
sustainability.
Yeah, it really is. I think that's kind of the most important piece, right?
Mm-hmm.
Is that what we want to create is an opportunity for our partners to be able to establish services, build communities. And I think that's another important piece, right? In the places where we work, the work has never been about just the clinical training because it can't be. And because we feel it shouldn't be. But early on, it was just because it couldn't be. You couldn't go in and provide clinical training without building a support community for the parents. See, when we first started working in a lot of the countries where we worked, parents were not bringing their kids to the centers. That was one of the biggest things that we were working with our partners to try to get people to do, was to actually bring their kids, and not only to the centers, but out of their houses. I can't tell you the number of times I heard stories about kids who are locked up, who are alone at home, and the parents don't know what to do and they're fearful. And that's the reality of the work we do. We don't talk about that a whole lot because it's a lot more fun to focus on the positive and all the great things that are happening. But at the end of the day, I wouldn't be here 18 years later if it weren't for those real things that are happening. And make no mistake, this is not like, oh, those people over there, they treat those people that. No, this is global. There are kids in the US who are also not being sent to school, not being brought to centers, not getting access to services because of the stigma around autism.
Yeah. It really makes you think that we have a long way to go.
We all do. Mm-hmm. We all do. And, I think one of the most important things, especially right now, is in really listening to each other, listening to each other's needs. Deep in the ABA community and the autistic self-advocacy community, and there's a lot of disagreement, there's a lot of disconnect, and there's a lot of shutting each other down that's happening right now. Mm-hmm. And context is decisive. And you really have to look at the context of what's being done and taught where in all of it. And it's easy to say, the puzzle piece is a horrible thing and we should not have it and it represents harm to us. Maybe not easy to say. That's not fair to say. But we can say that, right? And if we go into a community where a parent has been doing all this research and they're just looking and they're desperate and they're trying to figure out, and they see we're walking around and we have a puzzle piece on our tote bag and they're like, there's that puzzle piece. I know what that means. Right or wrong, it represents something to somebody. So it's not an easy cut and dry decision to say, hey, we're not using it anymore. It's like we've carried these bags around countries where that has been the one thing that has opened up a conversation with a family member in a market. There's a lot of conversation right now around, should we teach eye contact? Should we allow people to engage in stimming behavior? Should we not? And I get it. And again, it's nuanced and context is decisive. And in the context of, if you go into the market and you're doing these behaviors, potentially your life is in danger. We were talking with a staff member today who was reminding us that if you are a Black man engaging in stimming behavior, that could put your life in danger if you're dealing with the police. And so we really have to consider all of these aspects. And I get it. I get it. I want to live in a world where we can all be whoever we are, whatever expression it is. See, we've limited the expression of being human to kind of these binaries, right? Like man, woman, normal, not normal. We've done that. And it's really sad. because there really is no right way or wrong way to express being human. And where do we start with all of this? So we're happy to have the conversations with our partners around the world. We're happy to have self-advocates travel and share their perspectives. And also, they get to hear the perspectives of our partners who are dealing with these real challenges.
Thanks for tuning in to Autism Knows No Borders. Would you like to get more practical insights into our framework for decision-making? Follow the link in the show notes for the full conversation, and be sure to subscribe for more stories from people connected to autism, inspiring change and building community. Let's work together to transform how the world relates to autism. Thanks for listening. Take care.